The fire occurred in an enclosed space, and one account describes Django as being barely conscious, robbed of oxygen, inhaling noxious fumes. However, there's no record on finding the original hospital admission records. There's no record of depressed conscious level or airway burns on admission. So we're concluding that Django was probably able to extricate himself from the caravan without sustaining significant inhalation injury. Other writers have mentioned his injuries. They've talked about him being extensively burned, full thickness, knee to chest. And they've gone into graphic detail about the condition of his hand. However, again, finding the original hospital admission notes, it seems that this is somewhat of an exaggeration. He probably sustained burns of only 7 to 15% of his total body surface area, and these were mixed thickness with only a small amount of full thickness burns. Now, the instinctive response, if you're threatened by fire or by assault, is to raise your hands in front of your face to protect your face. Doing this exposes the dorsum of your hands to injury, and the thin subcutaneous tissue and superficial tendons there make the back of the hand very vulnerable. If the tendons are burned, you end up with a condition where the MCP joints are extended and the PIP joints are flexed, which is exactly the opposite of the position of function. Also, in the acute phase of severe hand burns, swelling can occur, which can result in compartment syndrome. Now, we know that Django subsequently had very good use of his intrinsic musculature, as he was able to play the guitar with just 2 fingers. So it's unlikely that he sustained swelling of the hand and compartment syndrome. The ability to play a musical instrument also depends on feedback. You need to know where from the touch receptors and proprioceptors, where your fingers are in space in order to be able to perform fine motor function. Nerve damage was unlikely in Django's case. The burn injury was on the dorsum of his hand, and the digital nerves run deep on the palmar surface of the hand. So any sensory disturbance would have been confined to the dorsum of the hand and wouldn't have affected his playing. He stayed in hospital for 28 days initially, by which time any superficial areas of burns would have healed. They didn't practice early excision and grafting in these days. However, they did occasionally debride wounds if they became infected. And this was a very painful procedure. It required general anesthesia with chloroform or ether, and the granulating tissue would bleed profusely, requiring cautery with silver nitrate. And in Django's case, this procedure was performed nearly 3 months after the original injury, which suggests that some areas had sustained deep or full-thickness burns. Delayed healing of a burn wound often results in recurrent chronic infection. We looked into the traditional remedies that Django would have received. The gypsy remedies would have included lard, honey, witch hazel, and elder bark, which would have been combined together to make an antiseptic poultice known as drab. And although these are mildly antiseptic, they wouldn't have been sufficient to treat this sort of chronic infection. And in an interview with Stefan Grappelli, who toured with Django for many years, Stefan noticed that Django's hand never properly healed. It would sometimes fester and weep and be too sore for him to play. So as a result of this conservative management, Django was left with an ovoid mass of scar tissue measuring about 30 by 20 millimeters on the back of his hand. It overlay the zone 6 of the tendons of the ring and little fingers, and the contractures severely impaired their ability to do anything of any use. Film archives that we managed to get hold of show no evidence of contracture of the leg or the elbow joint, so it seems that these areas healed completely. Now, modern-day surgical options for release of Django's post-burn contracture would require either an incisional or excisional release, joint capsule release, and flexor tendon lengthening. And the involved digits would probably need to be K-wired in position, followed by aggressive splinting and physiotherapy. The The scar excision would almost certainly expose the tendons, and these tendons, or would have to be covered with either a reverse radial forearm flap or a free tissue transfer. If the soft tissue contractures around the joints had been present for a long time, he'd have developed secondary joint stiffness of the DIP and PIP collateral ligaments, and that would have also required surgical treatment, capsulotomy, and skin and soft tissue releases. But understanding Django's injuries is only part of the story. With the loss of 2 fingers, how did he manage to continue to play the guitar at all, let alone go on to become one of the greatest jazz musicians in history? Well, part of the explanation probably lies in the remarkable length, strength, and flexibility of his remaining fingers. As you can see from these rare archive photographs, he has astonishing flexibility. If we look at the DIP joint of his middle finger here, it really is quite incredibly flexible. And it's also long. He's actually doing what's called a half bar. He's spanning half the fretboard of the guitar just with the tip of one finger. And here, his index finger, with the 2 distal joints of his finger, is spanning the entire width of the fretboard. So he did have remarkably long fingers. And analysis of video footage as well shows that he could actually get a span of over 120 millimeters between his index and middle fingers. So there was a lot of flexibility there as well. Okay, just how long were his fingers? Well, I collected as many archive photographs as I could of Django's hand, seen from a variety of angles. I had to correct the perspective using Photoshop. And then what I was able to do was to get hold of the original luthier's blueprints of Django's guitar. And from this, we're able to know the measurements, the width of the fretboard, and the distance between the frets at every point along the fretboard. So using this as reference, I was then able to estimate, and there's a little bit of guesswork involved, but I was able to estimate the length of his fingers. And it's a crude study, but the results were very interesting. We used 16 images in total, and the results were fairly consistent. Compared them to normal anthropometric data, and it shows that, in fact, his fingers are larger than normal, and in some instances, particularly the index and middle finger, are in the 95th centile for finger length. I was also able to estimate the degree of deformity of his ring and little fingers, the fixed flexion and extension deformity of the joints there. And to go one step further, and this is really getting into nerd territory, I do apologise, we were able to make a computer reconstruction of his hand from that data to give us some idea of just how much injury was involved. Okay, so obviously the length of his fingers and the flexibility plays a part, but there's also his musical technique to consider. Now, only a few minutes of very grainy film footage of Django playing the guitar actually exist, but analysing those has given me some clues into his technique, and this is where I'm going to attempt to demonstrate.